And welcome in, ladies and gentlemen, to KagolTalk. I'm your host, Andrew Kagol. It is October 10th, 2:30 p.m., so it's time for KagolTalk. And joining me here today, I'm extremely excited to have our guest on the show here today. We're going to be talking a little bit of politics, talking healthcare. I'll be honest, I'm not the biggest advocate for talking politics on radio, but having the gentleman sitting next to me in on the show makes it a lot easier, and just knowing that it's going to be pretty objective here. So Michael Signick, who is the Healthcare Management Program Chair at the MSB School of Business Brooklyn Center campus, is joining me here today. So Michael, welcome.
Thank you. Thank you.
Like I said, we're going to be talking healthcare. That's your background. That's your forte. As I said before, you're the Healthcare Management Program Chair for the MSB School of Business Brooklyn Center campus, as well as the Elk River campus.
Correct.
So
Yep.
if you have any questions, comments, want to get in on today's discussion, please call in. Join us on the show. 646-595-4014 is the number to call in. You can check us out on Twitter at KagolTalk. Tweet us if you have any questions about healthcare that you want us to talk about during the show. We'll certainly take as many of your tweets or phone calls as we can here today. So, Michael, let's get started. Tell me a little bit about your background and how and why you're such an advocate or expert in the healthcare industry.
I've been in it too long. That's,
Okay.
that's the basic thing. I have been in it over 30 years.
Okay.
Graduated from Iowa State many years ago in economics and business, and actually got started in healthcare with Blue Cross and Blue Shield as a market research analyst. And over the years, I've had kind of an eclectic career. I've worked with provider organizations, hospital organizations, insurance companies. I was the vice president of marketing for Health Fitness Corporation, was the senior vice president over United Healthcare. So over the years, I've worked in operations, marketing, all the different areas. So I have a really, what I view as a very balanced look at what really needs to happen in healthcare today.
Well, certainly. So I'm extremely flattered to have you on the show here, because the times that you and I have talked off the show and, at work and about the issues, the politics, everything that are related to healthcare. I've sat in a few of your class discussions. I'm just absolutely amazed at just the knowledge you have, and I see it in the students' eyes, like, okay, gosh, this is making sense. I can see them engaging in your class here. So, like I said, I'm extremely happy that you're on the show here today. Let's kind of get started in on the discussion. We talked a little bit about your background here, but in order to have a discussion on healthcare, you have to have some basic knowledge, basic background information. So what are some of the basic things that if you were to advise people, hey, you need to know this before having an educated discussion?
Yeah. Well, one of the things that healthcare is talking about now is they want people to be patient-centered, and they want engaged consumers.
Okay.
The thing that we have to remember, healthcare didn't want that 10 years ago. They wanted us to just select our benefits, do what we're told, and so we really didn't have a need to get involved. We just kind of followed the rules that healthcare put in front of us. And over the years, and this is what I tell my classes too, that healthcare is not complex when you really put all the pieces together. We have, over the years, tried to fix healthcare by just piecing things together. That's how we created, group insurance in the 1940s, and then we had Medicare and Medicaid in the 1960s, and we had managed care come in the 1970s, and all of it basically came together, and we didn't ever try to address the real problem. We've been talking about this. Actually, Teddy Roosevelt was the first one that wanted to talk about universal health care. Franklin Roosevelt tried to get universal health care in with the New Deal, but actually when Social Security was passed in the 1930s, there was one sentence in the Social Security Act that talked about universal health care, and the doctors then got so up in arms they took it out and basically said, we aren't going to goof around with it. The problem is now that our costs have gotten so out of whack, it is impacting our economy, our debt, our budget, that we've got to do something about it.
Okay. Like it says, Medicare versus Medicaid, what's the difference?
Well, Medicare is the federally funded government program, so that's for the over 65. Medicaid is it's kind of right now a 50-50 split between the government and the state for what was originally intended to be for lower income individuals. But unfortunately, what's happened is Medicaid now is one of the main payers for nursing home care.
Okay.
And as our population ages, more people are trying to do what they call spending down, getting rid of all their assets so they can get on Medicaid, so the state government and the federal government actually start paying for nursing home cares. And that's breaking the state budgets as well. So the difference is the Medicaid program it was originally intended for the low income, Medicare over 65.
Okay. And that, now, this will kind of jump into a little bit to what we're going to talk a little bit later, but is that a main cog in this issue?
Huge.
Okay, so
Huge.
that's the
Yep.
okay. Possibly the elephant
When
in
you
the
look
room
at,
almost.
and I have my classes, and I think all of them remember the 10 main reasons that are increasing in healthcare costs. One of the main reasons is our aging population. We have 10,000 seniors now hitting Medicare and Social Security every day. And that's what I'm trying to tell people, is
10,000,
we have
wow.
not even begun to see the increase in costs when that population moves into Medicare, and it is now about, I think, roughly 18 to 20% of the government's budget. As that starts to increase, that's when we're really going to hit the crisis point. We haven't hit it yet, but I'm trying to tell people it's like the train in the train coming down the tracks. We know it's coming. We've got to do something about it.
Okay. Now talk a little bit about collaborationhealthcare.com. That's your website.
Yeah, that's my website. I got so frustrated with people trying to tell me everything about healthcare and knew nothing about it that I put a website together that basically, because one of the things that's interesting is you have 75% of the population get all of their news about healthcare either from MSNBC or Fox. So you have both sides of the spectrum. And I was so frustrated with there wasn't one site you could go to look at, okay, who agrees with Obamacare? Who disagrees? Why? What is an accountable care organization? So basically, it's a portfolio of a lot of different studies and sites that people can go to get a little bit more informed. And that's basically was the intention of the thing. I'm getting about 5,000 visitors a month now coming to the site. Spending about 9 minutes, which is huge, coming to the site once they get there. So it's kind of told me that, look, people do want information, but they're really tired of this political spin that's going on right now.
And one thing I do want, before we move on to the next topic here, talking about, you have a community discussion coming up here on Tuesday, October 23rd at the Middle School Business Brooklyn Center campus. You want to talk a little bit about that?
Yeah, well, and basically it was intended to be a public service event. I mean, to basically provide a forum for people who really wanted to just get the facts and be educated and not get the political spin on what are the key drivers of what's causing this healthcare problem, getting people to understand, first of all, there is a crisis. And then second of all, one of the things that we have to understand is our role as consumers has changed dramatically, regardless of whether Obamacare stays in place or not. Basically, in the past, it was, you go in, you select your benefits from your employer, and then you don't really deal with anything until you need health care, and then you have to kind of go into navigation mode. What the new role of the consumer is going to be is not only the benefits manager, and one of the things to keep in mind, people need to understand, we're going to be if Obamacare stays in place, we're going to be buying our benefits totally different than we ever have in the past. That's with the Minnesota State Exchange. It's coming up, all of the rules and regulations going with that. The other thing people need to do, they need to be financial managers with their health care. 10 years ago, 15 years ago, you had a $10 copay or a $20, no big deal. Now the average deductible that people have to meet is roughly $1,200 before health insurance even starts to pay. So you need to be a financial manager. You need to be a care navigator. You need to be a legal manager. About 80% of the costs that most people will incur in healthcare in the last 10 years of life. That's where I am when I teach healthcare law and ethics. I talk to them about healthcare directives, healthcare proxy, to get people to start to understand you don't need to be 65 or 70 years old before you start to say, do you want me to be on a ventilator or not? That divides families. It's costly. Let's start to try, because right now about 25% of the people who say they want to die at home actually die in the hospital because they don't have a healthcare directive and the system kind of takes over. And the other thing that people need to be is care navigators, because our healthcare system is very fragmented. How do you navigate throughout the different specialties and hospitals and everything that's going on? They need to be informed. One of the biggest things we need to do is we need to take care of ourselves. 80% of the costs in healthcare right now are chronic, and most of those costs are related to the lifestyles that we lead. So what I'm trying to do is tell people, no longer can you just rely on the employer. You need to now start, for the financial well-being of yourself and your family, you need to start taking a more active role.
Well, he's Michael Zignick. I'm Andrew Kagol. This is Kagol Talk. We'll be back in 15 seconds as we talk more about healthcare and politics of, the current politics of healthcare, and with the upcoming election coming up here. So this is Andrew Kagol. This is Kagol Talk. I'll be back in 30 seconds. Attention, MSB Brooklyn Center students, upcoming events next week on Tuesday, October 16th. There'll be a student appreciation event starting at 10:15 till 11 a.m. in the student lounge. It's going to be a breakfast bar, so please feel free to stop by, check out the free food that the MSB Brooklyn Center campus staff will be serving. Pancakes, waffles, fruit and juice, all the good stuff there. So please stop on by, as well as at the end of the month on October 31st, Halloween, another student appreciation event will be going on in the afternoon. And now back to Kagol Talk. And welcome back into Kagol Talk. I'm Andrew Kagol. Joining me is Michael Zignick, who is the Healthcare Management Program Chair at the Minnesota School of Business Brooklyn Center campus, as well as the Elk River campus. And we've been talking about the current state of healthcare. And I think you and I, we both agreed, I definitely agree with you, that it's in a mess. How did this all happen?
Well, it happened because we were never willing as a country because we're the only developed country in the world that healthcare is not a right. I always ask my classes, do you think it's a right, or do you think it's just a privilege? And it's roughly 50-50. 50% think it's a right, 50% think no, it should be a privilege. We in the country, we value our individualism. Mm-hmm. And that's one of the things you hear, it's government takeover, all of those types of things, and we don't like that. So basically what we have done is piece together what I call a hodgepodge. We really don't have a healthcare system. We have a healthcare marketplace. And when you have a fragmented marketplace like we've got, from an economic standpoint, there is no way that it is going to be efficient, effective. And so basically the answer to your question is we've never really been willing to take the role to say, look, we've got to have health care included for all individuals, and because some people feel it is a infringement on our individual liberties.
All right. If you want to get in on the discussion here with Michael and myself, please call in 646-595-4014 or check us out on Twitter at KagolTalk. We're talking healthcare all day long for the next half hour, and trying to get an understanding of where and why and how this healthcare issue has happened and why it's a big mess, but also why it needs to be taken care of here. And you're talking a little bit about how we got into there. How we got into this mess. And, if you could go back looking at it, 10 years, 15, 20 years ago, what's been maybe one or two spots or opportunities that the government, the country missed on, saying, hey, you know what, we need to do, we had a golden opportunity and we missed it.
Yeah, I think I always say that healthcare had four major inflection points. Okay. Over actually since the 1940s. The first one was group insurance, where we link our health insurance to our employment. And that only happened because during World War II we had a wage and price freeze, and employers were not able to raise wages. Mm-hmm. So they were saying, as an enticement, we'll create health insurance, and then they got a tax deduction for it. So that was the first one. Mm-hmm. The second one was the introduction of Medicare and Medicaid. And so I always like this when some of the seniors tell me, keep the government out of my Medicare. Well, government is Medicare.
Yeah.
So when we actually passed that in the 1960s to get Medicare and Medicaid, that was government's real first involvement, and that's what we're dealing with today. Medicare costs are